Hi, I'm Lee Tucker. I'm a breast specialized pathologist and a person with a couple of decades of experience in breast center development, management, and quality program development. I'm very pleased to be speaking to you today about the NQMBC program, a program that is unique in healthcare and a program that is needed in breast care today. There are many reasons for this. For years, we assumed that quality was a given. And in fact, we all go to work expecting that we're going to do the best we can for our patients. And we do. But without the data to support the quality of each aspect of breast care, we really don't have the ability to compare ourselves over time and against other programs. So breast care quality can no longer be assumed. It must be supported by data. And if we were to doubt that, all we have to do is look to Medicare and the PQRS program to see that even Medicare now is very specific in its requirement for the reporting of quality data by not just breast centers, but by healthcare professionals and facilities throughout the healthcare delivery system. That's not to say it's easy. Breast care data collection is a burden. As you know, mining the cancer registry or physician offices charts or even an electronic medical record can be time-consuming and resource consumptive, and we have to be able to demonstrate the value of data collection. And the way we demonstrate the value of data collection is showing what kind of a job we're doing in taking care of patients. And the way we do that is preferably by an organized program that sets forth the important measures and also gives us the ability to compare our performance against those of other facilities providing similar care. Now, there are some aspects of NQMBC that distinguish it from other quality management programs, and I'll outline a few of those for you. First of all, NQMBC is breast care specific. It is focused on all aspects of breast care, but does not engage in the measurement of care delivered in other disease states, other areas of oncology, or clinical medicine. Another aspect of NQMBC that is distinctive is that the program was developed by professionals engaged in breast care and is managed and overseen today by breast care professionals of all backgrounds that are in active clinical practice today. In addition, the program endeavors to measure performance in the full spectrum of breast care, and this is what is somewhat unique about NQMBC is we begin with service levels. These are largely operational issues. Our operations directors in our breast centers may be familiar with some of these already, but attributes of service. How long does it take to get an appointment from a screen to a diagnostic imaging workup or an appointment in a surgeon's office? How long does it take to get a report? And another aspect of performance, not overlapping with service, is that of professional performance. Patients that receive poor service by virtue of a long wait time might conclude that professional performance is also poor, this so-called halo effect, when in fact the professional performance is exemplary. So it's important to be able to segregate these issues and measure them independently. In addition, there is a third non-overlapping aspect of care, and that is clinical outcomes. The sorts of measures we typically think of when we think of survival rates, such as 5-year survival rate, as an example. So the program endeavors to tie together these disparate areas of service level, professional performance, similar to what some of these specialty physician organizations put forth, and also then clinical outcomes measures. And there's another way to look at the quality delivered by a program, and that is on a different axis completely. And that is a axis that oversees or follows the woman's journey through breast care, beginning with the asymptomatic patient who submits for screening, through the referral for a diagnostic imaging workup, to surgical referral, to pathology reporting, referrals to medical and radiation oncology, reconstructive surgery, survivorship, and even in some cases to hospice and end of life. The NQMBC program doesn't currently have measures for every aspect of breast care, but new measures are under development. And one of the distinguishing factors of breast care is the ability to screen for the disease, akin to just a few other malignancies, and then to follow through the interdisciplinary pathway all of the care given through end of life. So when we consider attributes of service, professional performance, and clinical outcomes against the journey taken by the patient from screening through all of the diagnostic and therapeutic steps, we see that there is the opportunity to have many, many measures available. And what the NQMBC does is sort through these and picks the important measures, those that have reliability, credibility, or are well vetted by other organizations, and presents those to the participant in a cohesive package. This works because the NQMBC program leadership is multidisciplinary, from medical and radiation oncologists at our disposal to surgeons, pathologists, breast imagers, cancer registrars, nurses. There is a broad base of expertise that the NQMBC can draw upon to vet various measures and the way of reporting the data. And finally, an important attribute of the program that distinguishes it from most other quality management programs of any type is the fact that it is web-based, and it allows participants to submit data and immediately receive a report comparing their data submission with that of all the participants that have submitted data into the program, or to a filtered group that may include facilities of a similar type or size, as an example, to give a more apples-to-apples comparison. So I hope you can see that the NQMBC is indeed a program whose time has come. It is truly a multidisciplinary effort that is coordinated to develop well-reasoned measures in a way that allows for immediate response in terms of your performance relative to others, that it spans the continuum of care ranging from screening through diagnostics, therapeutics, and survivorship, and includes, importantly, attributes of the service delivery level, as well as professional performance, and as well as clinical outcomes ultimately.